I'll do it.
So just to give you a little bit about our practice, we're nearly 300 providers, about 110 locations, 13 service lines. Obviously, the majority of what we do is oncology and hematology. We see about 2,000 new patients a week. And yes, that's the real number. We did 1.4 million patient visits last year. We see patients from about 3,000 providers. I'll give you just a quick background on our imaging. For quite some time, like I'm sure a lot of you, we did basically PET scans and some CAT scans, and we farmed out our reading. So we did the technological portion of it and the pro part. We partnered with people. After a while, we got busy enough, and we also found that our reproducibility and the report timing and nothing was in our control. So we brought this in-house with the hiring of our first radiologist now, God, 6, 7 years ago, and bringing on Tim and Jared. I will tell you, it dramatically changed our game. And of course, the next step into doing total imaging is screening, which became and has become more important to all of us across all of our locations. We do more than 250,000 scans a year now, including MRI, CT PET, PSMA, DEXAs, ultrasounds, X-rays. I hate X-rays, but you got to do them in some places. We do have interventional radiology and mammography. Next, please. So our whole point on doing this was to close the care gaps. The first step was in hiring the radiologists, and this was more quality control than anything. It didn't save me $1, but what it did do is have people in the office who accessed the charts. They knew what a pseudo flare looked like from immunotherapy. They understood what we were doing, and they would pick the phone up. They also knew and would be accustomed to what our patient volume was like, who our patients were, where they were from. So we start on the detection side. We now do screening and surveillance, and Tim and Jared have put together really remarkable programs where we are an accredited lung cancer screening program. We do breast scanning and as well as prostate screening. We do a lot of identification for new patients eligible for procedures, and this Agamon has been nothing short of miraculous for. Historically, how did you know patients who would need a vertebroplasty? You'd have to count on all your doctors to look at their spinal MRs or X-rays or CAT scans and then make the appropriate referrals. Unfortunately, what we see is about a 30 to 40 to 50% identification of these patients, whereas with Agamon's help, we're identifying every patient that's appropriate for a procedure that's going to change their life. Same thing with PSMA scans. We have about 40 urologists, and we have a lot of oncologists who see prostate cancer patients. The indication for PSMA has been evolving so fast, my doctors can't keep up with who's the right patient or not. With Agamon's help, we identify these patients, get it back to the doctor, and they can say, oh, shoot, I shouldn't be getting an MR. This patient needs a PSMA. Let's change the scan. If I told you this doesn't happen every day, it happens more than twice, 3 to 4 to 5 times a day. It's been fantastic for us. We don't have patients who fall through the gaps anymore. We're now able to follow up on suspicious findings because of how the AI works within Agamon in our lung cancer screening and our breast cancer screening. All of these patients are put on a surveillance tract so that they are appropriately seen and rescreened. It also helps us on the treatment side. It helps us to do the follow-up imaging, to follow up on pathology because it cues us to do so, to follow up with the appropriate specialists. If we have patients on the lung cancer screening side who have an abnormality who now need to see a pulmonologist or to see a thoracic surgeon, it prompts our folks to do that and get it set up right away. It coordinates care across all of my teams, because if you could think about it, you don't have the same doctors or pathologists or radiologists who are seeing lung cancer, breast cancer, prostate cancer. They stay coordinated across multiple team sites, so everybody stays on the same page. Nobody is duplicating work, and we're not losing patients to surveillance that they need to have. And also importantly, we have long-term surveillance to detect recurrence. 5 years from now, we're not forgetting about that patient who had lung cancer, who are now know there is a long tail to the curve on lung, breast, and prostate recurrence. So you got to follow these patients for the most part of their life. Next, please. There's over 25 missed follow-up rate for cancer survival. So if you look at these numbers, ovarian cancer, 35%, melanoma, 32%, prostate cancer, 30%. And a lot of this is non-adherence rate among cancer survivors. We put them into a program where we don't miss them. We're now seeing single digits for missed a follow-up. We create sheets where we have automated callbacks to these patients to get them in. And then it only gets elevated to a live operator after they miss 3. So this way, we don't waste our time doing things that we can do through automation. But at the same time, for people who are not getting back, we get a real person to get them on the phone and get them in. It has been miraculous and remarkable for our clinicians and for our patients. Next, please. So Agamon Health has closed our care gaps by a multitude of ways: structuring medical reports with AI, automating the patient navigation workflow. You don't need to have a person doing all of this. It doesn't work. As soon as you take this out of a person's hand and you put it into, an AI-based system, you won't even believe the difference it makes in the follow-up and what we're seeing in patients. We're seeing enhanced referral coordination. We're actually getting the patients to the right doctors and then getting them back to us. So we're not losing anybody in that transition. Obviously, you're increasing your imaging revenue. If you have an abnormal mammogram and they need to have an MRI, and Agamon helps get that patient in, which is been fantastic in doing so, it does it almost immediately. Not only that, we've coordinated with Agamon and looking at some of the risk scores and put that as part of our mammography results to get the MRI then automated so it gets ordered, so the patient gets in right away for those patients who are deemed high risk by what their score is. We optimize staff utilization. I don't need to have patients and employees in every single office doing navigation when I have Agamon doing it for me for a third the price. It has made the biggest difference in how our practice has run since the EMR got put in. Next, please. So this is looking at what our follow-up gap was before. 30% of all reports require follow-up. 51% of these were not completed. And this leads to, obviously, late-stage diagnosis, missed revenue, and increased liability. When you let the patient fall through the gap, this is what happens to you. And this is the whole necessity of bringing in Agamon and letting them do it through their AI system.